Good morning, everybody. I'm Kit Kramer, President and CEO of the Asheville Area Chamber of Commerce. We welcome you to this conversation about homelessness. And we have a great panel that will help us today to understand how we're addressing homelessness, what the role of the business community can be, and what's going on currently as we emerge from COVID. I want to talk with you a little bit about some of the concerns expressed by business people as we emerge from COVID and the city's decision about camping and not allowing camping. And so that'll be part of our conversation today. This is a situation that we're not just facing in Asheville, we're facing it around the country. There was a recent article that highlighted both Charlotte and Austin, Texas, which I thought was super interesting. In Charlotte's case, they are handling the conversation around homelessness in context with a conversation about housing, which is certainly very appropriate. And again, a long-term issue for us has been the affordability of housing in the Asheville area. Austin has recently reinstated a ban on camping and panhandling in certain parts of their city. And they did that after a referendum, which passed 58 to 42%. So that was awfully interesting because when you think about Austin, it's a pretty progressive place, but that was by a popular vote. So I know that on the minds of business people, we've heard from a lot of people, particularly in areas where a lot of homeless folks do gather. And in a recent business sentiment survey that the Chamber sent out in order to get feedback from business people about how relief dollars, COVID relief dollars should be spent, homelessness, addressing homelessness ranked second only to schools and remediating kids that may have been messed up due to COVID and to the whole learning at home situation. Among the ideas listed in the survey were assistance for addiction and mental health issues, a program to provide eyes on the street to identify the need for immediate intervention, providing additional sanitation solutions for folks, as well as increasing resident, employee, and visitor safety. So this is a complex issue, and we're going to talk about it today. And hopefully, after we've heard from our speakers, business people will have a better understanding of the approach the city is taking, as well as how we as business people can join in addressing the problem. So I want you to know that the chat will be open. Please put questions in the chat and we will attempt to answer them. I'm going to introduce our panelists in alphabetical order. We're so pleased to have all of you with us today. So I'll ask you to give a slight wave as I introduce you. We have Cathy Ball, who is the Assistant City Manager for the City of Asheville. Emily Ball, no relation to Cathy, is the Homeless Services System Performance Lead for the City of Asheville. Dr. Blake Fagan is a family physician and Chief Education Officer of MAHEC, who leads the office-based opioid treatment services for MAHEC as well. And Sue Polston, a certified peer support specialist and executive director for Sunrise Community for Recovery and Wellness. Thank you all for joining us. We're so happy you're with us. So I want to start off with a question that I want to address to Blake. Many folks have been camping during the pandemic, and the city has said camping is a safety issue. What do you consider to be the health and safety implications of people camping?
Thanks, Kit, and thanks everybody for giving me an opportunity to visit with you. I look forward to your questions when we get to that section. Please, put them in the chat, and we'll pick them up as we go. But I mean, just to start with what is going on today or in the last year, so COVID, thinking about camping and how getting groups together can possibly spread COVID and other respiratory diseases, and then go to the sanitation side of things. when you do have large groups of folks that are gathered together and they don't have appropriate toilets or sanitation, there can be infectious disease that break out in those areas. But even more so for these folks, if there is a way to have folks that are unhoused receive housing, as they receive housing and they have safety, sorry about the dog, as they have safety, they're able to then address their medical and psychiatric and substance use issues.
All right, Emily, I'm assuming that we're trying to get Emily Ball back. So I'm looking forward to seeing her face again. But in the interim, let's talk with Cathy Ball. Cathy, talk to us about how the city is addressing the homelessness situation, especially in relation to camping, if you would, please.
Thank you, Kit. And again, thank you all for being on this meeting. We feel like it's really important to have conversation with the community about this issue. And as Kit said earlier, it's a very complicated and very difficult issue that it has been made worse and brought to light over the past year. The way that I would start is to talk about how we've been approaching our homeless population since the beginning of COVID. And Dr. Fagan talked about the fact that they were extremely vulnerable to getting COVID, getting sickness because of their proximity to each other, because of being in the same camps. And we began with the approach of trying to set up a congregate living setting at the Harrah's Center. And we weren't using that facility at the time because people weren't congregating, of course. So we were able to bring in 50 folks into that area and be able to provide them with meals, provide them with medical care and attention during that time in partnership with Homeward Bound and many other people who contributed to help us do that. We learned later on, as did a lot of communities, that there was FEMA money available to be able to move folks into a non-congregate setting, which allowed more privacy for people. It allowed them to be away from other folks that they could potentially get sick from. And so we moved folks into the Red Roof Inn in West Asheville, and that we have housed since the beginning of that, and it will end the end of June. But there have been 158 folks that have gone through there, and 42 of those have moved on to permanent housing. And that has been a real Asheville proof point for us that if people have the opportunity to get housed and get settled, then they have an opportunity to move into permanent housing and to no longer be homeless. In doing this, we have seen that model has worked, but unfortunately, it is a very expensive approach to addressing the issue. Recently, we have seen a lot of safety issues in the past probably 2 to 3 months as it's gotten warmer, with folks camping in public parks, mainly downtown. And from that, we had a lot of safety issues, not just for the neighborhoods or for folks who wanted to use the parks, but for the people who were in the encampments themselves. So we saw that there was a higher level of violence, higher level of drug use, and we felt like we needed to address it. And the approach that we've taken is to, in as much as possible, provide hotel rooms to folks in that situation. So we've worked with Sunrise, and Sue will talk about this, to be able to move folks into hotel rooms and get them stabilized and hopefully help them move on to being permanently housed. And we know that model works. And for that reason, because of the safety issues, we do not allow camping on city property. In a park, we have an ordinance that says you can't camp after 10 o'clock, and we are working to try to inform folks who may be there for that purpose that they can't stay. And then on city property as well, that they can't camp. Now on private property, it's always considered trespassing. So the option, if when that occurs, is that the police will enforce trespassing laws. So we're trying to let folks know that we're trying to provide other alternatives, but that we don't think it's safe for the community, and we don't think it's safe for them to be camping in the parks. That was a very long answer, Kit. I hope.
No, actually, I'm surprised that you were able to do it that succinctly, because it is a super complicated situation. Now, one of the things I wanted to ask about, and Cathy, I guess I'm going to rely on you to answer this since we have not reconnected Emily yet. In terms of, I think you alluded to this, there was a whole lot more visibility to homelessness as a result of the COVID restrictions that were placed on shelters. And so we've seen a lot more camping. Have the actual numbers of homeless increased in Asheville?
So the numbers, we do a point in time count every year, and it's done in January. And the reason is because that's typically when we will be able to know the people who are Ashevilleans that are not housed. And so what we saw in the numbers this year, that it stayed about the same. But we all know that we see a seasonal trend that happens in the summer of what we call transient homeless folks who come through, who are passing through, who may be going north for the summer. And so that population will go up in the summer, spring and summer months. But for as far as the homeless population who live in Asheville, that number has continued to be about the same.
Well, and that's interesting because, for example, in Charlotte, that number has definitely increased. So in a world of difficult news, that's actually, and I think this community is a very philanthropic community and has a lot of very fine people trying to address this problem. So Sue, I want to talk with you and ask you, how is the relocation going?
It is going. So we have 2 separate locations of hotels with a total of 70 rooms. We are in the process of actually moving from one of those locations into a different location. So there's been some bumps along these last 3 weeks that have kind of like delayed the process of being settled, I guess, to where we can really dig in and do the work. But I mean, honestly, overall, it's going pretty well, right? So we've had a lot of the folks come to us right off the bat and say, phew, now I have a shower, now I can have my clean clothes, now I need a job, you know? So, I mean, it's going well. It's going as well as it could, given the complex situations that are arising.
Yeah, in terms of, can y'all make a guess, you, Cathy, Blake, any of you, can you make a guess of, because we've talked about that need for jobs, and right now jobs are, there are so many employers looking for people. And when you are homeless, having no ability to keep your clothes clean, keep yourself clean, not having an address to be able to put on a job application, not having a phone to be able to respond to those businesses interested in hiring. I mean, being someplace with all those things is a huge step forward. But that being said, homelessness is a complex thing in terms of, and there are mental health issues and substance abuse issues. Of the percentage of people that we're currently housing, how many would you think are ready to go back to work? If you had to guess at a percentage.
We're in the process right now of assessing that. We actually have Goodwill has come to the table with all these employers ready to hire our folks, knowing that there may be some complex situations. And so Goodwill actually was on site at one of the hotels yesterday. I haven't got a report back of how that went. But just in conversations and being around at the hotels, I'd say a couple of handfuls of folks were ready, willing, and able. You know, they're at that spot. And then there's another tier of folks that may want a job, but they're not there yet. We've been able to link folks with medication-assisted treatment slots at local clinics. So, like, the work's happening. It's just a slower process. And you know, in the end, the hope is that everybody's employed or everybody's on disability, you know, whatever. So we'll see how that goes.
Yeah. Well, so as a business person, if I have someone who has been, for example, sleeping in the doorway of my business, or panhandling my customers or my employees, or there's some other nuisance behavior that is occurring, what approach should I take to addressing the situation? Kathy, you want to answer that one?
Yes. So if I would put it in this category, we have partnered with Homeward Bound for 2 folks to work as outreach. So what they are doing, they've recently been working with us closely on getting folks relocated from the encampments into the hotels. But when we're very close to getting to the point where they can do outreach in the community and walk around downtown and talk to folks that they know are obviously homeless and let them know how to be good neighbors where they don't need to be. They can't camp in public spaces or in private spaces. So that resource is available for businesses to also contact. And we've talked about doing training for businesses in terms of how to know when to call these folks and how to connect them to the 2 folks that we have from Homeward Bound in order to do that. So that is definitely a resource. I would tell you that if it is a safety issue, then you need to call the police, because the police, everyone knows that we have a number of vacant positions in our police department, and they are very short-staffed, but if it's a safety issue, please don't hesitate to call 911 if there is a fear of safety. Otherwise, what I would recommend, and we can put the information in, we can provide it, but the 2 folks we have as outreach people, if there is a specific area that we see, like Pritchard Park, where we see a lot of folks hanging out, we try to get them to focus on that area to be able to provide information about where shelters are, where they can go. Mm-hmm. So that would be my recommendation.
Okay. So emergency situations, call 911. Less than an emergency situation, perhaps nuisance behaviors, the non-emergency number for the police department, or?
Yes, that will work. The non-emergency, we can put some resources. We can provide you, Kit, with some resources that you could push out. And one of those is our community engagement division with the police department that you can email and say, we're seeing significant uptake in this location. Dana Frankel, that I know is on the call, is always willing to take an email or help direct us to places where people can go. Or we can also provide with phone numbers for the Homeward Bound folks. But we will provide you those resources that you can push out to the folks on the call.
That would be great. We would love to have that. I know I'm not quite sure what happened with Emily, but she was very, very eloquent in her expression of approaches that business people could take, that these people who are homeless are people first. And she strongly suggested reaching out, making eye contact, having a conversation to find out what the situation is, and perhaps if they're in your doorway, why they're in your doorway, so that there's some understanding and relationship that ends up building there. I'm hoping we'll get her back on, but in the meantime, we do have a question in the chat that I want to address. So the comment is panhandling has also exploded over the past year with people on nearly every corner. Do we have any restrictions on this or laws against panhandling? And has this discussion been brought up? I know it has been by me, Tyler. I bring it up a lot. Many people, if they're making good money from tourists by panhandling, are not incentivized to get a job elsewhere or to change their lifestyle concerning housing. Are those who are actively using opiates or other recreational drugs allowed to use these facilities? So who has a response on that one? Sue.
I can answer the last one real quick. As far as continued use for those that are actively using substances, we have very loose guidelines in place. It's mostly from the hotel's point of, so, folks aren't allowed to have visitors Folks are asked to not have any illegal substances on property, but we do know that it's going on. Like, people are continuing to do what they do. And like I said, we've been able to link some folks to some treatment already on that regard. We're not holding a sign up that says, yes, you can continue to use in your room. However, we do know that it is going on.
Mm-hmm. Cathy, can you address panhandling on the whole?
Yes, and I will tell you that Emily's having internet issues. I've asked her, she lives in City Hall, and I've said if she wants to come down to my office, we can get her on my camera. So panhandling is illegal. It is considered a low level offense. And so right now, with the staffing levels at the Asheville Police Department, they do prioritize what they can respond to. And unfortunately, unfortunately, it is more difficult for them to respond to panhandling issues. However, as I mentioned earlier, we can, in the areas where there's specific issues, we're happy to reach out to Homeward Bound once we get folks in camps and try to really work on specific areas so they can talk to them and try to tell them that it's illegal and that they need to move on.
Well, and I'll tell you, I know from having lived downtown for many years that some of the folks who are panhandling are not in fact homeless. And so we need to, I would prefer that people in our community support our entities that we know are doing really important work in addressing homelessness, and not provide funds to people on the street or on street corners or anything else. If you want to give them a bottle of water, if you want to give them a referral to a package of crackers or something of that nature, that's one thing. But well, there is Emily Ball sitting in Cathy Ball's seat. Cathy, thank you for working on things, and Emily, thanks for making this work. Emily, do you want to share anything with us since you haven't had an opportunity to share yet?
Well, first of all, I'm so sorry the internet has gone out, but I'm glad to be back. And because the internet's gone out, I'm not sure what you've already talked about, but if you could give me a little prompt, I'd be happy.
Well, let me ask you a couple of things. In terms of, we've already talked about how the city is addressing the homeless situation, especially camping. One thing we haven't talked about is the idea of a low barrier shelter. We've also talked about how the relocation is going. And the question I asked, and that I think you may want to weigh in on, is if as a business person, you have someone who has been in your doorway or has been panhandling your customers or your employees, or there's some other nuisance behavior occurring, what approach would you suggest that business person take?
Great, that's a great question. Well, first of all, I always love to just frame this kind of discussion around our common humanity, our shared humanity, that we are all just people and we're all doing our best. So I think it's really important that business folks just remember that people who are homeless are people just like everyone else. They're just people who are in crisis. And none of us are at our best when we're in crisis, and we always exhibit behaviors that are not ideal in that scenario. So I think just remembering that folks are really struggling and trying to connect with them in a human way, making eye contact, saying hello, being kind, smiling, asking someone's name, building a basic rapport, I think is really essential first step. Past that, then you have some platform where you can say, hey, I need to ask you to not, pee on my sidewalk, or whatever the case may be. Can we talk about this particular thing that's happening? Can you do that in a different way? It's much easier to address that with folks if you already have that baseline, just kind of human connection. So I would certainly say start there. Certainly it is okay to address those things that need to change. And then you all may have already talked about this, but Homeward Bound provides some outreach services in the community, and they are happy to jump in and help mediate situations like that.
Yes, and so we were talking, Cathy says she is going to give us some resources we can share with businesses about who they can call And we talked about the non-emergency number versus dialing 911 as well. All right, so, and I'm assuming Cathy is still in the room with you and can answer, and I don't know if some of these questions can be answered. I know that Susie Chandler, you talked about the Housing First model, and we did talk about the number of spots. I mean, that the number of homeless in terms of the most recent count has been basically the same. And so you said only 70 rooms available. I think we're at 160, correct? In terms of the number of rooms. So just wanted to point that out. And in terms of the emergency funding, I think the city and the county are both in the process of making decisions about where emergency funding would go. And the business community has certainly weighed in on that too. But it's nice for a change to have some dollars available to be able to address some of these chronic situations. Here's a question from Scott Rogers. Why is the city not utilizing the Homeless Initiative Advisory Committee for strategic planning to address camping and emergency shelter and not putting an RFP out for services? So Cathy, you want to give an answer to that one?
Well, I think that we want to partner with them for sure. And I think all of these organizations, in order for this to be successful, we all have to come together and be at the table. I think that right now we have been in a bit of a crisis situation. And so we have been moving like really, really fast in some ways and would love to be more inclusive. And I totally agree that we should be. I think we will be putting out an RFP. So I think the longer term solution, if we're able to move toward the solution that we know we have a gap for, which is a low barrier shelter, we would be putting out an RFP to look at who can provide that low barrier shelter and would be welcoming that in partnership with other organizations in the region. So we're open to all of that. I will tell you, it has been crazy busy in trying to address some of the safety concerns that we have around homelessness right now. And so we have in every conversation acknowledged that we have to have all of our community partners at the table in order to help us find solutions. So we don't want to exclude anybody. And I apologize that just by the pure nature of it, it has probably felt that way.
Well, it's interesting. One of the silver linings, in my opinion, to this whole COVID situation has been the flexibility, adaptability, and creativity people have shown in addressing needs and doing it in a really fast manner. Sometimes that may mean, I guess, that some of the processes that we're used to seeing out of the city may be a little bit different, but I think I'm always a fan for addressing the situation and moving to action. And sometimes I feel like we kind of get paralyzed in this community on certain issues, because this is an issue we've been dealing with for quite a while, including the traveler folks, the transient folks who come through our community on an annual basis. So that's another question we have here. Does the city have a plan for dealing with the transient campers? And the note here from Karen is that they tend to be more aggressive and intimidating, and they know their rights and will retaliate. And it feels unsafe for downtown residents and business owners and visitors. So is there a plan for the transient campers?
So with the switch in being able to move our outreach folks from Homeward Bound to being downtown more frequently, we hope to share with them that it is not okay for them to be sleeping in the public right of way or on private property, and try to let them know that this is not okay. I think we really want to put all of our effort into helping our Asheville homeless folks and really tell the other folks, this is not okay for you to camp here or be here. And so we're trying to figure out creative ways and would welcome anybody's help in how we pass the message along that for our transient folks, if they're passing through, they can pass through.
All right, we got a question here, and I'm not sure if anyone can answer this one. Does city leadership support Senate Bill 607, which seeks to ban mobile needle exchanges?
No.
Nope. Okay. And in terms of another question, I again don't know if anybody can answer this one. And Blake, you may have some insight. As part of the privatization of Mission, HCA was supposed to add 96 mental health beds. Do we know whether that has happened? I do know that there's a facility that's going to be built.
Yeah, sorry, I'm probably about where you are, Kit. So I don't work for HCA. I work in the hospital when I see my patients in there. But the last I heard is, yes, they were going to build more beds. I didn't know it was 96. I knew it was something close to that. But I don't know that I would say it's not completed, but I don't know where it is in the timeline. So
Yeah.
good question, but I'm sorry, I don't have more information.
We'll see if we can get more information on that and share it in the notes with the recording. Has there been any consideration, and I think you may have addressed this already, Cathy or Emily, but I'm going to bring it up again. Has there been any consideration for increasing the number of homeward bound staff on the street as part of the arrangement with the city?
I think if we can see that that's an effective model, I think we would definitely be open to it. We have had some conversations with Homeward Bound about doing that. We haven't been able to really effectively measure the outcome of that because the two folks that we have been working to help relocate folks into hotels. So I think once we're able to get them on the street and we see how effective that is, we will definitely evaluate the potential for other folks to help us with the same thing.
Well, and Pat, I know that, Sue, did you have a comment?
Yeah, I was just going to say, Sunrise also has 2 street outreach peers, and we'll be more than happy to maybe get into that and work with Robert and them.
Good. That's great to know. I know that from the perspective of downtown management, there's a theory that if you can continue to activate areas and provide services as needed, that you can prevent some of the problems that may ultimately exist. And for example, if people with a substance abuse issue are nodding out in a public space, perhaps it's an appropriate time for an intervention, and having folks who are looking to help make those connections could be helpful. So we had a question, why was the CDC recommendation to allow houseless to shelter in place during the pandemic lifted and encampments removed a few weeks ago?
So I'm happy to answer that, Kit. This is Cathy. What we saw is that there was, in fact, a negative impact on people coming together more frequently in larger gatherings and larger encampments, which was creating other safety issues in addition to COVID. And we also were having outreach to our homeless population to provide vaccination. So we were reaching out and bringing shots. We were in conjunction with a whole lot of nonprofits, trying to make sure that our homeless population was able to get vaccinated. But we just saw so many other safety concerns around the larger encampments that were happening.
Okay, well, Tyler has weighed back in on the urban campers, the transient population that moves through. And he says he thinks that they would be more responsive to legal reprimand under panhandling or vagrancy laws. And that isn't a discussion that to be held, but we're also dealing with a current situation of fewer police officers than we would ideally have, and discerning the difference between that traveler transient population and our own Asheville folks who have issues that have caused them to be homeless. Cathy, what's the current status with the police department and efforts to get staffed back up?
So the police departments, I want to clear this up because I think this would be of interest to the folks watching. There have been there have been a lot of vacancies in APD, but there have been no reductions in sworn police officers. So we have lost a lot of folks to who either decided this year they no longer wanted to be police officers, or have left to go to other communities. So we are trying to recruit police officers. We're trying to recruit the right kind of police officers. And that is a challenge across the country right now. I have talked to a lot of cities who are facing challenges with folks just not wanting to go into the field. But we have a lot of positions open and would encourage folks to apply, and we're continuing to recruit for them. This past year, during the pandemic, we had a freeze on several positions in the city. We never had a freeze on our police department positions or public safety. So we have continually tried to recruit for those positions, and we'll continually do so. But we are down approximately 1/3 of all sworn officers. We have 60 some positions that are vacant.
Well, and so yeah, it's been an interesting year also in terms of discussions around racial equity and justice and support for the police and support for policing in a different way. All those are also very complicated issues. If you can allow Emily to get back on screen, I would like to hear Emily's perspective on what business can do to help in this situation. Emily, how can businesses help?
Sorry about that. I think that's such a great question. Homelessness is such a community-wide issue. It absolutely takes a community-wide response. It means that we are all, whether we want to be or not, we are all stakeholders in this particular issue, and we all have some opportunity to act. I would say 3 things for folks in the business community. The first is we have a real opportunity to hire people who are homeless, people who are staying in shelters or who are in other programs. Certainly need employment. That generating income is part of the pathway out of homelessness. And so creating opportunities to really partner with organizations that provide that support to folks is a really essential opportunity for the business community to get involved. The second thing is landlord recruitment. And I cannot stress this enough. We know that homelessness is a housing issue, and the way that we end homelessness is by moving people into permanent housing. What that means is that we need those housing units to be available. And so we have multiple agencies in our community that have really a huge amount of rental assistance available right now, and certainly the supportive services to get people connected, get them stable once they're housed so that they don't become homeless again. The really essential part of that is landlords who are willing to partner with those organizations to provide those units. And the third thing I would say, I'm trying to make this a thing and it's not catching on so far, but please promote it, is YIMBYism. I'd love to promote some like yes in my backyard culture in our community when it comes to affordable housing development. We again have to have those units if people are going to not become homeless in the first place, but also exit homelessness into permanent housing. So support for developments, particularly that target units to people who are homeless, is really essential.
Amen, amen, amen. We need to be YIMBYs in terms of finding ways to house people closer to where they work for all the reasons. Blake, I would ask you, anything that immediately comes to mind that you feel compelled to share with this crowd?
No, to something that Scott Rogers put in the chat, and then Cathy Ball addressed. I think there's so much going on right now that I'm really pleasantly surprised at how fast things are moving, and yet when that happens, then communication doesn't happen as fast. So if we had 6 months or a year and a half to plan this, and we could meet with multiple stakeholders within the city and the county, and I mean lots of meetings, get everybody's ideas and form something up, that would be ideal. But how quickly that folks have been housed already is amazing. And so when that happens, a crisis or a problem gets solved, but sometimes not in the best way in terms of communication. So I'm really hoping that we can continue to communicate. When I say we, I mean all of us, and I'm looking forward to this further discussion about this thing called a low barrier shelter. And I think, Kit, you were going to bring that up. So I think that's where we are next, is to talk a little bit about that.
Well, thank you, Blake. Let's talk about what does a low barrier shelter and why is that a good idea? Because at first blush, you may think, wait a minute, so we're going to allow people to do whatever and still get care. Emily, you want to talk about that, or Sue, do you want to talk about it?
Emily, you can start it off.
So a low barrier shelter, that's certainly a term that has gotten a lot of buzz in our community lately, and that is exciting. But I just want to demystify it first and say that all we mean by that is a shelter that provides really great access to people with the most complex needs. So often programs across the country have barriers to people entering those programs, and those barriers are really legitimate. Things like requiring identification or asking people to be clean and sober. Those are understandable in terms of supporting operations. And it also means that we have folks in our community who are unable to meet those requirements and therefore are unsheltered. And so what we want to work on is a shelter model that minimizes those barriers so that it can be as inclusive as possible, can really bring in people regardless of the complexity of their need. I think part of our goal as a community is to screen people in based on the complexity of their need, not screen people out. But it means that we have to have a really robust operation that can be prepared to respond to those needs. So what we are working on right now is a vision around all of that. Again, recognizing this is a community-wide issue takes a community-wide response, and that's a component of our community-wide response, but we certainly will need a lot of support for that from all sectors in our community to make that happen. Cathy may have already said this earlier, but I think a critical thing for all of us to keep in mind is that homelessness negatively affects every single person in our community. Most importantly, people who are homeless, people who slept outside last night and are in severe crisis. We have to continue to develop interventions that really respond to that need for the benefit of our entire community.
It would be great if we had all the time in the world to be able to plan things out, but we do. To Blake, to your point, these are all, there's so many activities that have to move on a parallel path at this point in time in order to address the issues. And the fact that we've got money in the form of relief funding. I mean, is it 57 million at the county level and 26 at the city level? I may not be entirely accurate on that, but that is a huge sum of money it's one-time money. So it would be nice to be able to strategize around it, but then again, also the crisis is now. Well, and in the case of homelessness, the crisis has been with us for quite a while, but the opportunity, I guess, is now to make some definitive progress. Sue, anything you want to share about the idea of a low barrier shelter?
Yeah, the other thing that comes to mind, maybe just to change perspective or thought, that low barrier, the other terminology that could be used is high access, and a high access shelter, right? So just as Emily had talked about, IDs, breathalyzers, couples, right? Couples are asked to split in traditional settings for shelter. That's just, I know for me personally, I'd be like, nah, we'll just figure it out on the street, you know. People with dogs. So I do want to add too that out of those 70 rooms that Sunrise is staffing, that includes 5 dogs. So we were able to, house, and that's been a huge barrier for those 5 individuals with their dogs because they cannot access any other shelter. So it's pretty exciting just to and to know that this model works in other states and stuff, and to have us be a part of that and start the process. So it's exciting.
Okay, so we have a question from Tyler. He says, it just seems like a good idea to have standards for those coming into a shelter regarding sobriety. Why would we forego those standards? Cathy, I'm sorry, Cathy, Emily, I'm looking at Cathy's name on Emily's face. Emily, would you have an answer for that, or Blake?
Yeah, I can start that. I mean, I think it really is the same thing I said before, that we want to screen people in based on their need rather than screening people out. I do want to clarify that a low barrier shelter is not kind of an anything goes environment. It is not a free for all approach. It is that you want to reach out to people who need those services the most, but you have to be sure that your services are prepared to handle all of that really safely. Safety is a critical component of any operation working with homeless folks. So I'd say the goal is you want to meet people where they are. That is the reality of where they are. The reality in our community and across the world is that there are a lot of folks who are not clean and sober. It doesn't work for us to behave as if that's not true. And so the goal again is that our homeless service system and our community needs to develop the interventions that respond to that need.
All right.
Can I add to that too, real quick? Meeting people where they're at, right? So if we have these standards in place where you can no longer use substances to stay here, that just goes right back to what's happening right now. And we know that from a peer support perspective, like if we just meet people exactly where they're at, we continue to plant the seeds, provide the resources, the ultimate goal in the end, whenever that individual is ready to move forward into their recovery, we'll be right there. So, you know, my own experience, anybody that tells me I had to stop using, I used even more. So just really meeting them where they're at and providing the individual needs for each person. Yeah, to that.
I want to also mention on the planning process that certainly, as you said, we are trying to move quickly. We have a crisis, we have resources, but again, whole community response to this particular issue that affects our whole community. We certainly want to be sure that there are a lot of input opportunities along the way in that planning process. I have been talking lately about how people who are homeless in particular are the experts on what their needs are. We have to be sure that we include them in that planning process so that we develop an intervention that does respond to that need effectively. Service providers, I said yesterday, service providers are the number 2 experts on what homeless people need. We have to be sure service providers are included in any planning conversation, as well as other sectors in our community. So just want to say that, you know, I don't know exactly what that will look like yet, but we do want to be sure that there are meaningful opportunities for folks to be engaged in that visioning process.
So we have a question from Karen Ramshaw about whether as the city has been housing folks in the hotels, has there been thought of investing in an older, small hotel as an interim housing option that folks could use to get stable and find services or work, et cetera? Cathy, would you like to answer that one?
Sure. Thank you for the question. Yes, that is definitely a strategy that a lot of communities are using, is to use existing infrastructure that may be past its useful life in that capacity. So the city has been exploring the option of being able to look at potentially hotels that are existing to provide that level of service. And that is part of what other communities are looking at as well.
Gotcha. Okay. I want to bring us back again. I mean, we approach this from the perspective of business people, and Emily shared with us 3 different ways that business people could be helpful. Hiring of folks who are available to work and are capable of work at this point, because we do know some people will have to go into recovery. We would imagine that some people need to get back on medications to help control mental health issues, but there are some folks who would be available for hiring, and there are organizations in this town that work well with folks who are in that kind of transition, and my hat's off to them. The chamber is working on, we have a program called Inclusive Hiring Partners that is working in collaboration with the Housing Authority of Asheville, as well as numerous organizations in town that work with people who have complex backgrounds. Maybe they've grown up in generational poverty or have a history of having with the criminal justice system or with substance abuse, and can provide wraparound services to support that employee and the employer in helping make that transition, to help people transition their way out of generational poverty. But then there are other organizations who are also working all the time on issues of helping people with mental health issues and with substance abuse and other issues that may exist. So hiring, especially given where we are as a community in terms of the need for workers, could be a potential way for businesses to get engaged. We've talked about landlord recruitment. I was having an exchange with Emily about trying to identify how we identify landlords, because it's a really interesting time. If you've looked at the number of folks who are using facilities as short-term rentals or longer-term rentals, things of that nature, we know that's an income producer for many people, and maybe a secondary income in some cases in our community. But trying to connect with folks to provide any portion of their resources towards working with people who are either need affordable housing standards or even workforce housing, because there's a dearth of both. We need additional resources to house folks nearer to where they work, and will be a richer community for it by having that mix of incomes in our housing stock. And then we also need to consider YIMBYism. Whenever planning and zoning or city council or the county commission undertakes a look at proposed development, when developers come forward with options that provide that affordable housing option, we need to make sure that that is given weight, because it's not easy to make the math work for brand new developments in some cases. But when a developer is willing to do that, we need to appreciate it and value it and be supportive of especially when it's near our own homes. We need to be very careful not to be NIMBYs, not the not in my backyard crowd, but instead to be YIMBYs. We've only got a couple of minutes left. I want to leave a couple of minutes for each of you to make any comments you'd care to make. And Blake, I want to start with you.
Great, thank you again, everyone, for allowing me to be here. And I think it's exciting that we've gotten movement on the unhoused, and I'm excited at how quickly it's moved, but sometimes maybe not 100% in the right direction or the direction that everybody thinks it should go in. But I'm really wanting to say that MAHEC wants to be a part of the solution moving forward. And when we have a high access shelter or a low barrier for entry shelter that's coming up, when folks have complex psychiatric, complex medical and substance use issues, there's lots of providers in our community that are going to come to the table and want to help, but MAHEC wants to be right there and provide that help, because we know if we can help to stabilize those things, as Kit said, I think then places like Goodwill, but there's going to be lots of others that will come in, assess job skills, and these folks will be able to get jobs, and some of them will be able to get permanent housing. It will be a win for our whole community.
Thanks. Sue, anything you would like to share as final thoughts related to this?
Just kind of piggybacking what Blake said, and Sunrise is excited to be part of the solution. And it is going to take multiple agencies. It's going to take all of us as a community to come together and form teams to provide these wraparound services and all that kind of stuff. So I'm just really excited and feel really hopeful of the longer term outcome.
Great. And Sue, thanks for the work you're doing. We really appreciate you. Emily, we also appreciate you as well. Any final thoughts from you?
Yeah, thank you so much for this opportunity. Thank you for pulling this together. I am always excited for this kind of community-wide conversation. the main thing that I want to leave you with is that I 100% believe that homelessness is a solvable problem. I am just a true believer that that is achievable in our community. I worked at Homeward Bound for a long time. I have seen housing work amazingly well for really high needs people. It is possible for us to end homelessness. Homelessness is a housing issue. It means that we have to provide permanent housing as broadly as possible, and we have to provide those supports in order for people to stabilize and stay housed. But I want to leave you with some encouragement and some hope that I really believe we have a unique opportunity right now. We have a lot of collective will to get something done. We have a lot of resources to get something done. And we do know how to end homelessness. We're not recreating the wheel here. There are proven models that are on the ground in action in our community right now. We have an opportunity to take those to scale. So let's end homelessness. I honestly believe that's possible for us.
Great. Thank you, Emily. Is Cathy still in the room? Any final words from Cathy for this group?
Sorry for the dance that we're doing. We're both vaccinated, so we're a little bit awkward about the whole mask thing. So I will just say something really quickly. This is a moment in time. This is a moment in time where we have been experiencing, the homeless community have been experiencing a bad situation for a long time. And I have been in this community long enough to see that if we come together, we can do great things. We can make great things happen. And this is the moment that if we all come together, that we can work on this. And so my mantra has been, this is our moment to talk about homelessness, to end homelessness, to work together. And we hope that everything we do moving forward gets us in that direction. But it is going to take us continuing to have momentum and continuing to move along that path. And I appreciate everybody who's in attendance. I appreciate the partners who are on the call, who've been working diligently over the past several weeks on the work that we have been doing. But I am a believer that this is our time and opportunity.
Well, I want to thank each of you for participating. Thank you. And thank you so much for the work you're doing. Blake, I didn't thank you specifically, but MAHEC does tremendous work in this community. And we're so grateful to have MAHEC as well. And thank all of you for participating. We will record this. We'll get some additional resources and include it with the recording. And we'll likely put it on our coronavirus resource page for the Asheville Chamber. Thanks to everybody for participating, and hope you have a wonderful day. Thanks.